So as you said, I'm here tonight under Nurses Specialized in Wound Ostomy and Continence Canada. And let me see here if there we go. So you've already done a land acknowledgement. I would like to say that I'm coming to you this evening from the unceded territory of the Algonquin Anishinaabe peoples, but our programs are across Canada. So in Canada, we live, learn, and work on traditional Indigenous territories. So we pay our respects to the First Nations, Métis, and Inuit ancestors, and affirm our commitment to respectful relationships with one another and this land. So tonight, what I really want to do is go over the program that we've developed to discuss, give you an overview, to describe our mentoring opportunities and the application process. So one thing I really want to start with is acknowledging the PSW contributions. First of all, we had our PSW peers collaborate on the development of this program. So it wasn't nursing dictating. We worked closely with our PSW colleagues to develop this program. And that was really central to the development. So I really want to really acknowledge their invaluable contributions made. As Cindy and I were just talking about, our PSW colleagues are really our first line of defense. And, you know, to me, they're part of this nursing family where we all collaborate together. And it extends so far beyond, you know, often people think of both nursing and PSWs as tasks. Well, the doctor tells us to do something and we do it. And what we do is so much more than that. So it's not just about task. You know, our PSWs become the trusted confidence and compassionate companions and advocates. And, you know, we have to acknowledge as well that often, you know, they're providing very intimate care for patients and seeing our patients at the most vulnerable patients, clients, residents, depends on where you work, what you call them. But basically, you know, we're there as part of the nursing family, we see our patients as the most vulnerable. So without this dedication expertise, we know that our patients will be so worse off. So what we really wanted to look at was from a skin health perspective, from a wound ostomy and continence perspective, where was there an educational gap? Because you know, for the last 24 years, I've spent a lot of time educating in the Ottawa area, and we started looking where else is there? And really it's overall skin health. And then in the elderly, we call it the big three, which is moisture-associated skin damage, skin tears, and pressure injuries, and overarching skin health. So these are the areas that we really need to work in collaboration. So some of the outcomes are, we know that if we work with our PSW colleagues and make sure that they understand those risk factors, that we're going to see early identification. We're going to have lower rates of skin tears, pressure injuries, and moisture-associated skin damage. And when we look particularly in our aging population, these are the skin issues that cost lives. They really impact quality of life, and they're very costly to the system. So we know that we can greatly improve quality of life. And I'll give you an example. If somebody develops a pressure injury on their heel, they can no longer mobilize. And if somebody is, we know that if we take an elderly individual and they stop mobilizing, most likely they're never going to mobilize again. So these kind of things, knowing in advance and preventing, are just so important. So we know that early detection is huge, and we know that the value of regular skin monitoring, but not only monitoring, knowing what to do if they do find something. So really this education emphasizes the importance of that communication and collaboration so that we develop strong collaborative teams between our nursing colleagues and our support workers so that we're really working in collaboration. And we know, you know, I can't not put on, because one of my biggest roles as a NSWAC, that's what nurses specialized in wound ostomy and continence are called. And one of my biggest roles is I'm supposed to help the long-term care facilities maintain their costs, so providing cost-efficient care. And we know that prevention is so much more cost-effective than treatment, and that really our PSWs help to minimize those costs. So these are the objectives of the program. If I take a step back and look at the program we put together to address the things I was just talking about, one was to provide an overview of the anatomy and physiology of the skin. So to really understand how the skin works to protect us, to recognize the risk factors for skin tears, pressure injuries, and we call it MASD, moisture-associated skin damage, and then to look at preventative strategies, describe risk assessments, and to describe collaboration with the healthcare team. So we developed this program, as I said, in collaboration with our personal support worker colleagues, but we also went to the personal support worker standards of practice. We looked from across the country. Today, I just pulled up the overview for Ontario, but we looked at the standards from across the country. So when we look at some of the things that around the program are designed, so it's competency and standards of practice and evidence-based. It's 6 weeks, self-paced, interactive online. So there's no classes for someone to go to. They can do it in little pieces when they get time, and they can go back and forth, and it gives them time to really absorb the material. It is a rolling start, so that you can start at any time. We also have weekly mentorship rounds with experienced NSWACs who are CNA certified. So every week we have an office hour where people can log into, they can ask questions. We do little tiny interactive sessions, and as you know, they can bring questions and maintaining patient confidentiality, of course, but they can bring their cases. The other thing that we're working on, I had a meeting yesterday with the CNA, the Canadian Nursing Association's accreditation department, and we're working on getting this accredited by the CNA. And right now there's a certificate of completion upon completion. That sounds kind of funny. So the cost of the program would be $50 per student, or if a facility is going to buy a license, it would be $2,500 unlimited for the facility for 2 years, meaning that they can put as many staff through as they want over a 2-year period. So they'd buy a license. And if a larger organization is going to be buying a license, it would be $10,000 unlimited for 2 years. So that would include whether it's home care or long-term care or acute care, that would be an unlimited license for multiple facilities. In the long-term care area, we have one larger conglomerate that may own 80 homes. So this is why we've set it up this way. But for an individual home, it would be the $2,500. But if a student wanted to do it individually, it would be $50. So I want to give you a quick sneak peek. We will be launching this program in a couple of weeks. We're just finishing our beta testing. Are you able to see my browser now?
Yes, I can see it.
So what happens when you come into the program? And this is what the first thing that you'll see. So here's where we would have where you could meet with your mentor, and we're going to have a link here that they can just click on, and it'll bring them right into the mentorship hours. We have a recommended schedule. We have a course forum, very similar to what you have in your for your discussion forum. We have a course forum where students can ask questions or they can connect with one another. And then here's where they come down and they would come into the units. So I'm going to go to my favorite one because skin tears are kind of my baby. So they'll click on this and it brings them into a separate screen. And I just got to minimize it here so I can see it. And I'm hoping that you can all see this. So my browser's being a little bit slow. Here we go. So when they click on it, they come into the course, and I'll just and it basically it's interactive, so you can hover over buttons. And you can there's drag and drop features to help explain. So we've tried to make it interactive so it becomes a little bit of fun. And we can the little knowledge checks questions along the way. Good thing I got that right. And then, we really go over different things throughout. So we try to make it interactive as possible, and said we've got this so that we have, We start with maintaining skin health, and then we move into moisture-associated skin damage, pressure injuries, and skin tears. We have a small little final quiz, and then there's a certificate of completion, which they can download at the end.